Welcome back to New Day Cleveland. So a few months ago, live on the air, you might remember, I was at Apex Skin. They removed and biopsied a spot that was on my face. And when those biopsy results came back, I found out that that spot was basal cell skin cancer. So Apex Skin was with me every step of the way. I'm so grateful for them for that, because after going through one cancer scare, going through another, it just, it makes you really nervous. So from the spot check to the biopsy to then the Mohs procedure that helped me to ultimately get rid of the skin cancer, they were there. And joining me today is the man who did it for me, Dr. Jorge Garcia. He is the founder and president of Apex Skin. Thank you for being here today, and thank you for helping me.
Of course, thank you.
I know, and what I love about your approach on things, if we have a concern and then you look at it, you'll say, you know what? Let's just take care of it for you so you have peace of mind. And I know we have to be proactive, but once we get to that point of needing Mohs surgery, I think it's important for people just to understand what Mohs surgery is, first of all.
Yeah, Mohs surgery is the gold standard for skin cancer care. So let's say you have a skin cancer in your face, and the Mohs surgery procedure is a procedure where you take it out with a very small margin, and we check the margins as you're waiting, like when we did it with you. So it's a very quick turnaround. The Mohs surgeon usually is able to do the removal of the surgery of the cancer. They look at the pathology, basically to make sure the cancer cells are out, and then subsequently either stitch it up or not, or have the discussion with the patient whether they're going to stitch it or not. But it's a 98% cure rate, which is the most important thing. And at the end, you walk in with cancer, you walk out of the office without cancer, which is really powerful, and that's what gets me going, because I love that purpose.
Well, the amount of skin cancer you have treated and your offices have treated, I mean, it is astronomical.
Yes, we have 4 Mohs surgeons, and all we do, our Mohs surgeons, that's all they do every day, skin cancer. So we have treated over 100,000 skin cancers through combined as a group. So, I always encourage patients, when you have skin cancer, go to a place that has expertise. And our surgeons, by far, they're super comfortable, and it will make you feel comfortable too, because that's important when you go into the office and understand the treatment plan and make sure you're comfortable with your surgeon and the procedure.
Yeah, and I felt that every step of the way. I mean, as you said, you go as minimalistic as possible initially to see if we can get it all out. We had to go back in a second time for me to make sure it was removed. But the spot overall, I mean, my scar is healing amazingly, and I'm blown away by how easy this procedure is. And I am not one to be able to handle things that make me queasy, and blood and the thought of what was going on makes me queasy. But you walked me through that process so easily that I just hope I encourage others to do the same thing, because I mean, what happens if you don't take care of it?
Right, so that's a really good question. A lot of my patients ask that, because skin cancer usually doesn't hurt people. It's like a little bump. So we tell people, skin cancer can spread, no matter, like any other cancer, right? If you don't get it treated, it can spread down to your lymph nodes, or you can have a bigger hole, bigger defect, or some people need extra, you can't do it in the office. So it's important to be proactive, and I always tell people, if you have a skin spot, just get it checked. We have a spot check program at Apex, but if you have a dermatologist, go see them, have a biopsy. It's always good to have the peace of mind of the diagnosis, to have something that when you rule out cancer, then you don't have it, you're good, for your peace of mind.
So those who are, there's us getting a picture together. It was such a piece of cake.
That was really cool.
But honestly, for someone who is nervous to do it, I mean, I think what you just explained is you gotta just go. And we have to be proactive too, because the doctors aren't there to look at every spot on our body at all times.
Listen, you know your body. So we see you once or twice a year. So anything that's suspicious, that's changing or bleeding or not, enlarging, get it checked. It's a skin biopsy is a very simple procedure, and even the Mohs surgery, it's like going to the dentist. It's very, very easy on the patient. You just wait while you're getting the results.
That's the best part, because with other types of things, when you're getting something biopsied, it takes weeks to be able to figure out if everything was removed and is okay. With you guys, when you come in for this, you were in 20 minutes. I was out of there after you checking twice to make sure you got everything.
And that's the cool part. Like we're checking in real time, which is really cool. That there's not a lot of procedures that do that. So that's the cool thing about the Mohs surgeons, is that you have that expertise to look at the cancer cells, make sure you get them out, and that's important when you're treating somebody's faces, or you have a big tumor in your back. You want to make sure you get it all out, but also conserving as much normal skin as possible.
I will say the one thing that I don't think I told the doctors was the fact that it would bleed sometimes. And when you said that then afterwards, I thought that was a sure sign probably.
Yeah.
So
and sometimes, you know, especially around the hairline, people think, oh, I nicked it with my comb or I brush or I had the curling iron, you know. So be proactive. You know, if you have something that's bleeding or crusting and that lasts more than a month, you know, don't blow it off.
And again, you can do some same-day appointments to get spot checks, things like that. They make it so simple at Apex Skin so that you don't have to deal with something very serious. I mean, you really give us every opportunity to make sure that we're okay.
Yeah, listen, days like today, super sunny. Make sure people wear sunscreen. My tip is to wear sunscreen, SPF 30 or above. You know, seek shade. Make sure that you are proactive when talking to your dermatologist about any skin checks, and you know, come see us. You know, like I said, we have same-day appointments, self-scheduling. We make it really easy for people to come in.
And also a wonderful event that's taking place that you are always a part of. I know I was there last year and had a blast being a part of this. The 5K Runner Walk, Miles for Melanoma. It's August 3rd. Sunday, August 3rd, Edgewater Park. I know you would say, come and wear your sunscreen.
Yes. Well, this is a really cool event just because we are awesome. You know, we've been sponsors for a while, but it really connects you with the people, right? So here's where you can celebrate people that are survivors, you know, celebrate people that have died from melanoma, but at the same time, connect with your patients. And, you know, it's such a much energy of an event that I love going there every day, every year, and, you know, running and, you know, being there with people is awesome. So.
Well, and I know, don't do what I do to him, please, because I walked up to him in the green room and I said, hey, I have a spot on my lip now that I'm concerned about. He's going to have to deal with me the rest of his life now. Ask him, is this okay? Is this okay? But you are a phenomenal doctor. 15 locations at Apex Skin all over. He is a wonderful team. I thank you so much for everything you've done. You've put me so at ease. Thank you.
Thank you for having me.
He's really the best.
Appreciate it.